All right, let's get right into it. Every time you step into a hospital or a clinic, there's this invisible process working around the clock. You could call it a silent guardian. It doesn't wear a white coat, but honestly, it's one of the most important things keeping you safe. Today, we're going to pull back that curtain and talk about medical calibration. Just think about this for a second. The thermometer taking your temperature, the IV pump giving you medicine, that machine analyzing your blood. What if it was just a little bit off? It's a pretty unsettling thought, right? And it really sets the stage for why this is so critical. So, let's start with the heart of the issue. It all comes down to a fundamental question of accuracy in the very tools we trust with our lives. And look, I'm not exaggerating here. This isn't like your bathroom scale being off by a pound or two. In the medical world, the margins for error are razor thin. A tiny deviation, a single degree, one minuscule drop, that can completely change a diagnosis, alter a treatment plan, and quickly spiral into a life-or-death situation. You can see here how all these dangers are linked. It's like a domino effect. An inaccurate reading leads to a misdiagnosis. That wrong diagnosis, well, that leads to the wrong medicine being given. This whole chain of errors, all starting from one single uncalibrated device, can end in unreliable procedures and, yeah, the worst possible outcomes. Precision is literally the only thing holding all those dominoes up. So how do we stop that domino effect? How do we keep everything standing? Well, that brings us to the hero of our story, the safety standard that underpins, well, pretty much all of modern medicine. And that standard is calibration. To put it simply, calibration is basically a tune-up for medical equipment. You're taking a device and checking its measurements against a source that you know is perfectly accurate. It's kind of like setting your watch to the atomic clock to make sure you're right on time. Except in this case, being on time means being precisely, life-savingly correct. And when you see it side by side like this, the difference couldn't be more clear, right? On one side, you have everything you want in medicine: reliability, safety, accuracy. And on the other, risk, inconsistency, and just plain danger. In healthcare, there really is no middle ground. It's one or the other. Okay, so this precision is obviously important, but how is it actually maintained? Well, it's not magic. It's a very meticulous, repeatable process that builds a system of trust, one device at a time. It really all boils down to these three key steps. First, you compare. You take a device, let's say a lab centrifuge, and you test it against a master standard that's known to be perfect. Second, you adjust. If it's spinning a little too fast or a little too slow, a technician fine-tunes it until it matches that standard exactly. And finally, and this part is vital, you certify it. The device gets a sticker, a seal of approval that says, yep, this has been checked and it's ready for patient care. And you know, this isn't a one-and-done kind of deal. Precision needs constant vigilance. At the very least, most critical equipment is calibrated every single year. But just as important, any time a device is repaired or serviced, it has to be recalibrated right then and there. Why? Because you've got to make sure the repair itself didn't knock its accuracy out of whack. It's this constant cycle of verification. And this applies to some of the most common tools you'll find in medicine. I mean, think about it. An improperly calibrated centrifuge, it could fail to separate blood components correctly, which could lead to a totally flawed test result. A thermometer that's off by just 1 degree could miss a critical fever. And micropipettes? These things measure incredibly tiny volumes. They could throw off an entire lab analysis if they dispense even a microliter too much or too little. Every single one has to be perfect. Okay, so let's zoom out and bring this all together. What's the ultimate payoff for all this meticulous, behind-the-scenes work? What's the real-world impact of all this? This right here is why it all matters so much. At the very top of the list, always, is patient safety. But it also means that a blood test in Tokyo will give you the same result as one in Toronto, all thanks to international standards. It maintains the quality of billion-dollar hospital equipment, and, most importantly, it acts as a firewall, minimizing the risk of those awful preventable medical errors we talked about at the start. You know, I feel like this quote just captures it perfectly. It's not a person, not the doctor or the nurse, but it's every bit as essential. It's a system, a process, a guardian that makes sure the tools of healing are themselves healthy and accurate. And it's there protecting every single patient who walks through the door. So I'll leave you with this question to chew on. We usually think of medicine as drugs or surgeries or new therapies. But what if the most fundamental medicine of all, the one that makes everything else even possible, is simply precision? What if just Getting it exactly right is the most powerful treatment we have. It's something to think about.